Thanks, Viz. Well, my name's Susan Hahn,
And I'm Manoma Shu.
and we're going to do this presentation together here. First of all, I'd like to, the binders and the handouts that you have, there's one slide per page. I'm the pollution prevention specialist with the County of San Diego, and I never would have had one slide per page.
No,
We
we're
would
very
have liked 6, so if we were going to have all these handouts. So this, you can write that down on the evaluation. In fact, I'd appreciate it.
Absolutely.
And Minot, you're the CUPA coordinator.
Oh, I'm the CUPA coordinator. We both work in the San Diego County CUPA, which is the Department of Environmental Health. And there's something else we wanted to let you know, that this is just a studies in waste classification for 4 unusual waste streams, and that there aren't any new laws. We're not giving you any regulation guidance or anything, just waste classification.
But first of all, we want to let you know that if your lasagna hasn't settled or you're a little queasy, we have some pictures in here that might be a little disturbing. So just watch out. It's going to happen. And we do get our laws and regs from the state. We do ask them for guidance on things, so just beware. So our topics today, we're going to discuss biotherapy. We've got 2 new medical devices that have been approved by the FDA, and we're going to do waste determinations with those.
We're also going to talk about preserved specimens, specifically 5 specimens that are used for dissection, usually in high schools, but could be used in any arena. Different fixatives and preservatives and what they're used for, do some waste determinations based on that. And then we're going to talk about, in San Diego, there's this medical waste treatment device called a digester, how it works, and also do some waste determinations on that.
So first of all, biotherapy. Biotherapy is the use of living animals as an aid to medical diagnosis and or treatment. The 2 we're going to discuss today is maggot debridement therapy and leech therapy. There are other biotherapies. They use dogs to sniff out cancer, to detect seizures, and so on. But the 2 that we're going to discuss today are maggot debridement therapy, sometimes it's called larva therapy, and leech therapy. And here we go. 2 new medical devices are approved by the FDA, and they're classified as FDA-approved medical devices. Not pharmaceutical, medical devices, which is kind of important in our later waste determination. Medical devices are also like stents, pacemakers, and so on. And the FDA did kind of play with this and think that maybe it should be a drug. But because the action of the maggot and the leech is more like a machine-like, they chew things up or suck things out, that it's more like a machine. So it's more like a device. Prior to the FDA, there was a Council of Pharmacy and Chemistry that was the predecessor to the FDA, and they had approved maggots. So, but they did not require controlled studies like the FDA does.
Well, and they're the first live animals to earn that distinction.
Maggot debridement therapy has been used, I mean, there's documentations or indications that it was used way back in the Mayan Indians, Aboriginal tribes in Australia. This is Russell Crowe's shoulder in The Gladiator. And what they did is they grabbed maggots out of some decaying carcass and just packed it in his shoulder. And it was, used properly. That's what they did. They knew to use it then. They didn't have controlled studies, but, they knew what maggots would heal that wound.
Well, and about after the Civil War, the field surgeons and the doctors back, like at the medic bases, would notice that the wounds that had been infested with maggots healed much better and much faster than the ones that hadn't been infested. And then in about the 1940s, when penicillin came around, kind of maggot therapy was dismissed and not used as widely. And the sources of maggots were kind of questionable back then. Where do you get them?
So we need to discuss the maggots that are used. So it is a Phoenacia sericata. It's a type of fly that lays these eggs that has the larva, the maggots. And this type eats only dead tissue. Now there are other types that will eat live tissue, like this screwworm here. Screwworm. Now take a note, let's see, what is the pointer, of these 2 little hooks here, because I'm going to talk about them later. That's the hooks of the maggot.
Right, and it's important to note that screwworms aren't in the United States right now. They've been eradicated for many years, but we definitely only want the necrotic flesh eaten, not the living tissue. So
So don't get them mixed up.
Pick the right ones.
So today, they're approved by the FDA, and if you're a licensed physician designated and certified to use this type of treatment on a patient, this is how you would get it. They're raised in a controlled environment. You hear California, UC Irvine, is a Dr. Sherman. He's also involved with the Veterans Affairs Hospital in Long Beach also. This is how they come. There's some gauze, and in there are the eggs. So you would order them, and then within 24 hours you would get it. And then what they're used for is non-healing wounds. And non-healing wounds are caused by a lot of reasons.
All kinds of reasons. Bacteria can cause non-healing wounds.
This I don't think is in your packet because we've just added this because it helps in the waste determination. But non-healing wounds are caused by pressure ulcer. People that are non-ambulatory in wheelchairs, and they don't get a lot of blood or oxygen circulating, they get, things get stagnant and they die off.
Bed sores, that kind of thing.
Chronic leg ulcers, non-healing traumatic wounds, and infectious wounds, Pseudomonas aeruginosa, and methicillin-resistant Staphylococcus aureus, MRSA. So let's talk about a MRSA infectious wound. Let's say this is, we're not for sure, but let's just say it is. It's red, it's inflamed, it's with yellow pus. And these might not heal with conventional therapy. Typically a surgeon or somebody will try and they'll cut away. They'll try and cut away the wound and get all that dead tissue and infected tissue out of there. But sometimes surgeons will cut too much away. Sometimes they won't get all those nooks and crannies where bacteria might be harvesting, and creating more bacteria. So sometimes these don't work.
And oftentimes you hear about MRSA in hospitals, but there's also, little joke here. MRSA's going to get you before the Asian flu does, the doctor says to the patient. Don't worry about it. We'll get MRSA first.
Because we've heard of MRSA. You've heard about MRSA more and more in the news these days. And you think of it in hospital where it's very clean, you have all these superbugs coming out. But nowadays you hear it more about in the community, acquired, like in institutions, college dorms.
Schools, yeah. It's resistant to all the penicillins that we have, in case anyone didn't know.
Okay, so this is where you got to see, did the lasagna settle or not, so. No.
Closed-toed shoes, please.
And so here's your wound. And it's yellow and it's pussy. And there you can see some maggots. I hope you can. I don't see it too well from here. But so what happens is the physician ordered the maggots. They got the maggots from the Monarch Labs. They took that gauze. And in that gauze is some feeding stuff. There's some soy protein and there's some brewer's yeast. And it's the eggs. They'll probably heat it up a little bit to get the eggs to hatch. They take that gauze and they'll pack it in that wound. And all of a sudden now you got these maggots that are hatching, and they got the munchies. So so what the doctor does, it kind of must be funny. Come on, the maggots got the munchies. So what they do then is they put more dressing on top of this to catch the drainage from the wound, to keep the maggots in the wound, because you don't want maggots rolling around a hospital area. It's kind of be upsetting to other patients. And also you want to keep it aerated because the maggots need air, the wound needs air, and the drainage needs to come out.
A couple of reasons people will use maggot therapy, and just some things that you should know about maggot therapy is that it's pretty reasonable cost. I don't know exactly what it costs to get a jar of maggots, but it's a lot cheaper than antibiotics, especially
$70.
real exotic antibiotics. Do you know how much it costs?
$70.
Oh, so it's cheap. It's generally acceptable to the patient, but I guess I've never had maggot therapy yet. But patients report a little squirminess and a little tickling at the site. So they pretty much accept it if it's the only treatment that the doctor thinks. And for the most part, the staff accepts the treatment. So they secrete digestive juice.
So what's pretty amazing about the maggot is that it's multitasking. Once it gets in that wound, it has those two little hooks, and it digs that dead tissue because it only wants to eat dead tissue. So it breaks it up, and then it kind of spits out some proteolytic enzymes, and it's breaking up. So it takes that dead protein, that dead tissue, and it's breaking it up into a semi-liquid state so that it can eat it. It dissolves it so it can eat it. So it's taking away the dead tissue, and that the saliva, the enzymes, is like an ammonia base. So it increases the pH, so now we have an alkaline environment, and it's killing other bacteria that are there. So now you see you have a pretty, it's pink, it's healthy, it's healing here. And the wiggling, of the maggot inside of the wound, it's kind of massaging it. So it's kind of, getting the blood circulating, the oxygen there. So it's doing all those things at once. This little teeny maggot, it's about
2 millimeters in length to about 10 millimeters in length. Can't really tell the difference, but they're real small and they stay small.
So when the maggot's in there, it's the eggs, and the life cycle of the blowfly is such that it goes through many stages, but in here the maggot's going to molt twice. So you got the egg, you have the first instar, the larva, then the second and the third.
So here's some pictures courtesy of the Biotherapeutics Education and Research Foundation. It's the same guy Susan's been talking to, Dr. Sherman gave us these pictures.
So here's a diabetic with a gangrenous ulcer on his leg. It's not healing. Is it infected? I don't know. But the reason, it's diabetics, they have poor circulation, they get wounds, they get ulcers. This is one. So in the 90s, Dr. Sherman did some controlled studies to get this treatment approved by the FDA, and this was one of them, using diabetics.
And just so you know, this guy has been in the hospital at this point with this wound for 5 weeks on intravenous antibiotic therapy, and this is what's been going on for 5 weeks. And then?
So that he tries the maggot debridement therapy. This is it after, how long is it after? 2 weeks. 2 weeks. You can already tell it's starting to heal. Got some nice pink flesh there instead of that rotten, dark, dying tissue. 3 months after, it's pretty well healed. You got some new skin there, you got some, scarring, but I think that's better than amputation.
So this is the perfect time to ask the question.
So what do you do with the maggots? They've done their job. What they do is they place them on these wounds for like about 2 to 4 days, and they're molting twice, and they got that gauze in there. They're changing the dressing that's one of the layers of dressing that's the drainage is coming out, and that's going out as in red bag waste. It's infectious, it's drainage, it's human fluids. However, now you got these maggots. So what they do is they take that gauze where the eggs came in, they take that first layer, and they recommend, well, first of all, I'm sorry, I'm going a little too fast. In the wound, like I said earlier, we have the maggot pupating, going into its different stages there 2 times. So we have the second and the third instar. So what happens after that is that they like to bury themselves deeper into something. So when they use maggots on a patient, they want to be careful so it doesn't enter like in a nostril or an ear, because it wants to bury deeper, wants to do its thing, to pupate and become a fly.
So as they're changing out these 10 millimeter long maggots with the gauze, they're putting them in red bags. That's the answer to your question. They're putting them in red bags according to the package inserts.
And this is what you'll get when you buy a vial of maggots. You will get this package insert, the product insert, and it says discard in red bags designed for autoclaving or incineration. They say immediately take it, double red bag it, remove all the air, seal it closed, because really don't want them escaping, because you are in a hospital setting most likely. And they want all the unused larvae also destroyed in a similar fashion. You don't want them to mature.
And in San Diego County, we happen to regulate the Medical Waste Management Act, which is a California Department of Public Health law, so not a DTSC, but a Department of Public Health law. So we're wondering ourselves, well, do we regulate this just because they put them in a red bag? Does that make them medical waste?
So here we go. Here we are, regulators, and so we want to do a waste determination. So first of all, is the material a waste? Are there any statutory regulatory exclusions? Is it a medical waste? Is it a listed waste? Is it waste subject to the mixture derived from or contained in rules? And is it a waste a characteristic waste? Because we're regulators and we like to do all these crazy things. Even though it seems like it would be common sense, this is a waste determination that we like to go through. The little dance that we do.
So we're sure it's a waste at this point because the package insert says not to even reuse unused maggots. And they get so big, they're going to pupate, they're not going to be usable again. So we're sure it's a waste, but then the question is it a medical waste?
So to be a medical waste, it must be 2 things. It must meet 2 criteria. First of all, it must be waste generated during the diagnosis, treatment, or immunization of human beings, and so on. And yes, it is used in the treatment of human beings. And it must also be biohazardous waste or sharps. Well, those hooks don't make it a sharps waste. It's not going to puncture through.
Not that cut and dry.
Because it's not dead tissue. If it was dead tissue, then maybe it would, but it's not, so it doesn't. So is it biohazardous waste?
No.
Well, and here's where we determine biohazardous waste is also defined in the Medical Waste Management Act. And these are the different things that would make it biohazardous.
Just refer to your gigantic sheet of paper because we know it's not really readable up there, but we know you have it in here.
So the first one, lab waste, including human and animal specimen cultures from medical or pathology labs. Maybe. It's not really a lab waste. It's coming from a patient's treatment.
A lot of times the laboratory doesn't even get involved because of the quick turnaround time. A doctor who's been trained to use maggots and certified to use maggots by Dr. Sherman's office goes and gets, or orders the maggots directly. So it may not even go through a lab. So we're not sure if it's from a medical or pathology lab.
Human surgery specimens suspected of contamination? No. Not really, even though they sometimes do refer to the maggots as microsurgeons. C, animal parts, tissues, fluids, or carcasses. We can laugh at our own jokes. Animal parts, tissues, fluids, or carcasses suspected of contamination.
Maybe. I mean, it's a kind of a carcass.
But sometimes when you have a wound that's not healing, the doctor it's usually more of a circulation problem. Sometimes it gets infected because that wound is such a nice environment for an opportunistic pathogen or bacteria.
Sure, because you're not sure if they actually suspect that it's contaminated by an infectious agent. Maybe.
So wastes that were isolated by infection control staff? Perhaps, if it's a known MRSA. Nowadays, hospitals are testing for MRSA, but even to get that test completed, it's about 2-3 day turnaround. So who knows? It's not fixed with formalin, it's not chemo, and pharmaceuticals. That could also make it a medical waste. Since it's kind of iffy on some of those things and it's not done, we're not sure.
Maybe.
Maybe it's a medical waste by definition. Maybe it's not, depending on the situation. Even though most hospitals are going to double red bag it and do the right thing, Would it come under our jurisdiction? Maybe. Only if it's what they're suspected of contaminating. So per manufacturer's instructions, yes, manage it as medical waste. Double red bag it and have it autoclaved. But a concern, because we know flies are a vector. We know they transmit disease. They transmit the Bacillus anthracis spore from a sheep, the anthrax from sheep to a human. They'll transmit that. So, we got these maggots and maturing into flies. Will they be contaminated if it was MRSA, if it was Pseudomonas? Will they be transmitting this organism? And then this is what it looks like. It looks just like our housefly, doesn't it? I mean, I think it is one of the houseflies. And it's really brilliant colors. I just think that's pretty cool. So now we're going to move on to leech therapy. This is a nice leech. It's a Hazardous medicinalis leech.
How do they...
Who knows how you catch leeches? None of the San Diego people can answer this. How do you know, how do you catch a leech?
Sit in the bar, have a couple of cocktails.
Close. You got to be sitting in the swamp. The leech actually catches you. This is how they catch them. For scientists, they go in and they walk in the swamps and then they wait till they get attacked. They just wait till they attach and suck. So this is it. This is a Hazardous medicinalis. There's over 650 different species of leech, and this is the only one that's been approved by the FDA. We've gotten drugs as a result of mimicking the leech and its enzymes that it has inside of it. And properties are still being discovered. They're trying to catch some exotic leeches, so they can test what's in there. And sometimes some of the guts and what harbors a lot of what's inside is difficult to reproduce, whether it be bacteria or proteins or enzymes that are in the leech. So,
as with maggots, leeches, the use of leeches can be dated as far as the 18th century, mid-19th century, and the purpose back then was for just plain old bloodletting. Like, they felt that, the doctors of the day felt that if you had an ailment, they would just sort of attach leeches to certain parts of where the ailment seemed, and it would just suck blood out of you as a treatment method. And kind of, they realize, through time you kind of realize that it's really not doing anything. It's not working at all. But in the 1950s, physicians, researchers, cut the leech up and realized two things. One, blood wasn't coagulating in its stomach, and they isolated hirudin, which is the enzyme that's the anticoagulant.
And there's also a vasodilator in there too, so it helps remove the blood. So let's talk about how leeches are used. Here we go with this guy here, and he's had his ear tip reattached. And what happens is when they reattach a small appendage like this, the artery walls are pretty thick and they're easy to suture up to get blood to flow into that reattached part. However, the veins are thin and they're difficult to reattach, and so the blood usually congests in there. It doesn't flow out. So this is what happens, is that it gets congested and it's pooling, and eventually this would die. So what they do is they attach the leeches, and I guess it takes a little bit of experience in tricking the leech to attach at first, like maybe use a little bit of blood on there or something so it's attracted to it. So then it attaches, and it has these like 3 suckers on it, and it has little teeth on it that does its action. But have you ever, sometimes you hear about these things, we've been having fun with this and wonder, how did somebody lose an ear? How did he, and he doesn't look like his head is cut or anything. Was he playing with a knife?
Like at Benihana or something?
And then, so the only thing that we really came up with, Mike Tyson. That's how you lose an ear. Poor, Evander Holyfield. But I think his was kind of chewed off.
A couple things, yeah. This is chewed off, so you can see on the right picture that it's not a very clean cut, so it'd be super difficult to reattach. And
it was before the leeches were approved
for
treatment.
Before the approval.
So we don't know if it would have worked for him. I don't even know whatever happened. I don't know. Anyways, let's go back to what the leech does. So what the leech does is it attaches, it sucks blood till it's full, and then it falls off. But what it does, because it's an anticoagulant and it's a vasodilator, is that the blood, it continues bleeding after the leech has fallen off, because it has that anticoagulant in there. And it'll do this until that the veins will kind of heal themselves and do their thing. So here it is, 72 hours. The leeches have been applied every 8 hours for periods of 15 to 30 minutes.
That's a lot of leeches.
That's
a lot of leeches.
Because once they eat, they're done.
They don't even want to eat for 6 months after they're done eating, so it's kind of leech intensive.
6 days afterwards, you can see where it's starting to heal somewhat and it's viable. And here it is 2 months, where it's fully healed. You can hardly tell that it was what it was at the very beginning, right there.
It's like magic.
So, it's magic.
So what do you do when the leech comes off? How do you dispose the leeches? Susan?
Well, I contact Leeches USA. Where else would you go?
Where else would you go?
And this is kind of interesting talking to them, because I'm not sure what they thought when I was calling, because on the internet, on their website, it said to put it in a 70% alcohol solution. Well, I'm thinking we got human blood, bloodborne pathogens, and they want to put it in alcohol. And isopropyl alcohol, 70%, will disinfect a countertop, but it's not going to kill bloodborne pathogens. So I wanted some more clarification. So I called them, I emailed them. And then they were saying, well, the 70% only puts them to sleep, then you put them in 100%, and then it kills them. And then we went back and forth. I go, well, wait a second, what's going on here? And then this is what eventually they told me, that they'll place them, just needs a few mLs, just enough to cover the used leeches. And then you place them in 8% ethanol for 5 minutes just to put them to sleep. And then you're going to kill them with 70%. And then to dispose of them as you would other infectious waste.
What do you think was going on there?
I have no idea. I was thinking, first of all, maybe they thought I was with PETA or something, these poor little leeches.
Don't worry, we put them to sleep first.
It was really odd. We went back and forth a number of times, too. So it was, I don't know. I know, it's still, I have a few questions about it. They also say never reuse a leech and never return to used leech to the pharmacy. Because usually, versus the maggots where you order them from the lab within 24 hours when you want it, the leech you could have in a pharmacy up to like 6 months. They just keep them in like in a salt water solution, and they're there. They're ready for use. So, well, this is kind of just what I said. There's just a minimum amount of ethanol needed, he said, just to kind of cover the leeches in a beaker, let's say. But, you know, we've inspected a few biotechs, and some of these biotechs also use like fruit flies, and they kill them with an ethanol solution once they're done doing their research. But sometimes, you know, they just don't cover them slightly. They overfill, you know, so you have so many of, you know,
More's better.
A little bit of fruit fly and then a lot of alcohol. So thinking that, you know, that would be kind of common practice among people, especially when working with leeches, this is something we wanted to consider in our waste determination. So he also mentioned, the vice president, Rudy Rosenberg of Leeches USA, was to incinerate the leech. They were very specific on incinerating the leech, not autoclaving, but incinerating. And he also mentioned, and it's also in the literature, that the sucked blood will remain untouched in the leech intestine for 6 months. So it's just slice open the belly, and I guess it would just be like human blood. So here we go again for a waste determination.
Back to the dance.
Is it a waste? Well, yes it is, because there's no reusing it. It's spent material. There's no recycled property of doing, you know, reusing a leech. Any statutory, regulatory? Oh. Waste. Means any discarded material.
I need to put a plug in for the Wednesday afternoon class that Steve are teaching on the big kahuna of recycling exemptions, because that's what's referred to in little a here. Go to their class.
Free leeches every week.
I wanted to bring samples today, but they wouldn't. They didn't think that was a good idea. So to meet the definition of a waste, a material is a waste if it has to be relinquished by any of the following. Disposed of, yes, that was in the product's instructions. You can't reuse a leech, and it must be burned or incinerated. And the product's inserted said to be incinerated. Medical or hazardous waste. Well, in the Health and Safety Code, it talks about mixed waste. Medical waste, hazardous waste, rad waste, medical waste, hazardous waste, and so on. And usually it's the most challenging of the two, I guess is the right word.
The more hazardous.
The more hazardous. Medical waste wins. So, is it a hazardous waste? It is if it meets one of these conditions here. And we thought it would meet 2A. It exhibits any of the characteristics of hazardous waste identified in Article 3 of this chapter.
Maybe, yeah, it might.
Okay, so, and that's D001. Fixed, and it's the alcohol, the flammability. Is it fixed or drowned, that it's fixed and drowned in? Does it exhibit a characteristic? But first of all, we knew that there were some exemptions in regards to aqueous solutions of alcohol. And so we looked back at the facts because we had heard of them there. And in facts 12274 talks about the concentration of alcohol. If it's less than 24%, it would be exempt. This is at least a 70% solution of alcohol, so it would not meet this exemption. The concentration of water has to be at least 50% by weight, and this is not. What if it contains another solvent that would decrease the flash point? Well, it doesn't. It's just alcohol and water. So it wouldn't meet any of these exemptions. And this has been a kind of good tool for us, and I'm not sure if you guys know, so we're going to just take a little break and talk about facts back here and what it is. And today it's not FactsFacts, but it's RCRA Online.
And if you remember FactsFacts, then you're as old as us.
This is a URL that you would go to. You would select Advanced Search.
But there are other search options you can choose. Advanced Search is if you know the FactsFact number, but Susan will show you what the website looks like on the next slide.
This is what it looks like. That's a URL, Advanced Search, but there's also Topic Search, What's New.
Where's topic? There's Topic Search.
Yeah. So you could go by any of those ones and query what you're looking for. This is what the Advanced Search page would look like. And then here we have the FactsFact number that we used. We click on that. And this is what would show up. The alcohol content exclusion for the ignitability characteristic, the D001. And then this is a document record detail. Well, and then here's California's hazardous waste and recycling letters, which is very similar to the RCRA Online. So there we went ahead and put in Matt Peterson's name.
Thanks,
and
Matt.
we searched him and we came out with 9 files found out of the 870 files searched. So if you had a topic, you could also do that and find some information. Let's get back to leeches. So we have the leeches. They're in a beaker with alcohol. They're dead. So the liquid alcohol would meet that D001 RCRA waste flammability, so it is a hazardous waste. What we've recommended that they do or do with the fruit flies and with these leeches is to pour off, decant that alcohol and manage it as hazardous waste. And then you still have these leeches. Now, is the leech an ignitable solid waste? Who knows? Have you ever looked at the ignitable solid waste testing method? And we would have to have a control leech and a leech with alcohol. And what I've read and what we've heard of is that the burn rate would have to be faster in the alcohol soaked one than the other.